Across our communities, myths, stigma, and misinformation continue to affect the health decisions people make every day. That is why Reach Out Health Awareness Foundation, ROHI, brings you Health Connect Forum, a public health education program created to inform, empower, and promote healthier communities through accurate and practical health conversations. From mental health and maternal care to disease prevention and community well-being, Health Connect Forum brings experts and communities together to address the issues that matter. ROHI invites health partners, organizations, corporate bodies, and individuals to join this movement through sponsorship, collaboration, and participation. For more information, visit www.rohi.org, call 0703 044 8318 or 0813 973 0664. Health Connect Forum, powered by ROHI.
A mother asking what her choices mean. A classroom where a simple lesson turns a worried face.
All right, it's another beautiful Wednesday morning here in Nigeria's Federal Capital Territory, FCT, Abuja. It is the program Health Connect Forum. My name is Imo Ebong. I'm your host. It's indeed always a pleasure to be here with you and spend this time, have our beautiful conversations at this time every Wednesday on Municipal FM 95.3 Abuja. Know that we also relay the program live on Amak Community Radio Karachi. Wherever you're listening from, if you're watching online, we bid you welcome and thanks for joining us. Health Connect Forum is a public health education and awareness program dedicated to informing, educating, and empowering Nigerians to make informed health decisions. Joining us today, once again, is Barrister Mrs. Pat Udechukwu. She is a medical legal practitioner, a women's rights advocate, a trained nurse and midwife. She is a trauma coach, a clinical and mental health counselor, and Chief Executive Officer of Matrix Health and Ethics Consulting. Barrister Mrs. Pat Udechukwu, it's a pleasure to host you on the program once again.
Thank you. We're here again, Imo.
Thank you.
It's good to be here.
Welcome. All right, so today on the program, we have a very interesting conversation as usual. The topic today is stigmatization, myths and misinformation, barriers to health awareness and access to accurate information, and intergenerational and interfaith perspective. Intergenerational emphasis on intergenerational and interfaith perspectives. Thank you for joining us as we examine a challenge that continues to undermine health outcomes across communities: stigmatization, myths, and misinformation. Well, these issues affect maternal health, mental health, HIV, immunization, cancer, and other conditions. Across generations and faith traditions, false beliefs shape how people interpret illness and respond to care, often delaying treatment and worsening outcomes. We'll go straight into the conversations. I'll deliver the questions and our guests will do justice to them. And we trust and hope that you will join the conversation, leave a comment or contribution in the course of the conversation. Did I forget? Of course not. The program is brought to you by Reach Out Health Awareness Foundation, popularly known as ROHI. You want to join us and be on the program, you want to partner, you want to contribute, whichever way, we're open. Our doors are open for partnership and participation. Get in touch with us. Visit our official website. That is www.rohai.org. That is www.rohai.org. You get all the information on how you can be part of this amazing and life-touching program. Barrister Mrs. Pat Udechukwu, we'll come straight to you. What do we mean by stigmatization? We talk about myths and misinformation in health, and how do they differ Talk to us.
Okay. Good morning, everyone listening to us this morning. Okay. Stigmatization is what people have come to believe. And that belief that they have is affecting how they make decisions. But they believe it because the community where they belong, where they find their identity, holds such belief. So stigma is a belief in a particular community or group of people that is affecting the choice they make in a particular area of their life. Forever, it could be the stigmatization could be directed at their health, could be directed at money, the way they make money. It could be directed at, but this morning we are particular about how it affects health. And then we are talking about how people interpret health outcomes. So it does because, for example, if there is a stigma in a particular community, which is still happening on a woman who delivers by cesarean section, you see, they believe that there's something wrong. There's something she has done wrong, or else why would she not just deliver by herself? So it's going to affect the way this woman is going to seek help. So sometimes you see them there. I had several incidents like that in the course of my practice. Okay. There you are telling her that, look, for so and so reasons, you won't be able to bring this child, just like that. You have to go through CS, you'll be okay, the child will be okay. And they will say no. Sometimes they'll keep dragging on until it's too late, or they will just leave. And you may hear later that the mother and child died. So and it's so painful. That's why stigma is something we all collectively have to do away with. And the interesting thing is that this stigma is just there. It's not like it's life. As in, okay, this stigma is coming from where we took life. No. We came by it as a community and we upheld it. And sometimes it's just born out of myth. It's not something we can hold. It's not tangible. Facts. It's not facts. And that's why we must fight it.
Okay, so let's look at why this spreads. From what you have said, I'm trying to paint this picture. You contribute to it until the day it happens to you, or you become a victim of something that you have also contributed to. The question is, why does this spread fast within our communities, be it within places of worship, be it on social media? I hope that one day we'll be able to face social media and really look at it and how it is impacting our communities, our way of life, our tradition and everything. But for today, we're talking about why this spreads within our communities, even within faith cycles, religious cycles, on social media, by word of mouth. You hear say this person say, in common parlance, will say, them say, I hear say, them say. And over time, it begins to look like the fact or truth. Why?
Because when you go, even though it goes around like them say, when you check very closely, you find out that it's coming from opinion leaders. That's why it has weight. Or it came out, but the opinion leaders have not spoken against it. So it looks like by their body language, they agree with it. And don't forget, we have a communal approach to almost every aspect of our lives. So if in a particular religious setting, there is this, or even in just one sentence that the leader will just make and say, it's only lazy women who deliver through cesarean section. It has become a stigma. Those who go for CS are over time stigmatized. So it's either by body language, by word of mouth, by maybe even a careless posture from an opinion leader, or those whose personality hold a significant measure of influence on the people, then it becomes a stigma. I mean, a 10-year-old child cannot come and say, why did you deliver? It won't mean anything. The 10-year-old child doesn't have much influence, and it's not an opinion leader. So it has to come from there. And that's where it's important when we're looking for answers. we should go
Look
to
in that
certain
direction.
direction. Yes.
All right, you've talked about leadership. What about the followers? What about the people in the community? What role does the individual or the community, members of the community, really play in all of this? Because if we leave it on just leadership, it will be a one-sided conversation.
You see, leadership is a very strong factor. It's a strong factor because of the influence it bears on the followers. And leadership is very fundamental to human existence. Again, also remember that the last time we were on air, I talked about the fact that as a people, we are very communal in our approach to living, even though we are trying to move towards the individualistic approach now, but we are still not there. We are more communal. So most of our things we do, our beliefs, our way of doing things is still from a communal approach. So sometimes it's really difficult for people to just get up and say, no, I'm not going this way that everybody's going, I'm going to go this way. And for anybody to even want to do that, they have to be properly informed. They have to have enough knowledge that will empower them to do that. So it brings us to the level where we ask, do the people, the followers, have enough knowledge to even question what had been the status quo?
Okay.
You have to know enough to say, no, this thing we have been doing is wrong. Let's do it this way. I know that this way is better. Do they have the knowledge? And that's where, that's part of what we are doing. We're bringing enlightenment. Roha is bringing enlightenment to the people that, look, this is what is factual. This is what is evidence-based. So that the people can also say to their leaders, let us look at this direction, or let's look at this other side of this particular thing we have believed for a very long time. Until they have this knowledge strong enough to sway them to think differently, they will continue to be influenced by what has existed or by what the leader says.
Okay. Well, how does stigma affect early medical care? If it does, so does it?
It does. It does. It does. I just mentioned the one on CS. I also mentioned, autism. That's another example. And interestingly, autism is a spectrum. Like,
Okay.
it's not every child that has autism that is at the same level of symptoms or manifestation of it. So, but not many people have this understanding that this child can, with proper care and the right kind of training and education, still grow to live his life. You just direct him to what he can do with himself. So in some places, there's still a stigma that once this child starts manifesting autistic symptoms, something, in fact, in some places, is considered a spiritual problem. And that nothing can be done about it. So the child is abandoned, and it gets worse. The child is treated with a stigma. Even some people won't let that child come close to their own children. And you know how that can hurt. And sometimes they don't even expect the woman to take care of that child. They expect her to move ahead and have other children. That this one is like a lost, it was a mistake, which is not right. No child planned to come by himself or herself.
Very touching, and I trust that as we continue in this conversation, our listener can relate with some of these things. Let's quickly look at the health areas that are most affected by stigma. Can we touch on a few of them?
You mentioned it at the intro. Fertility, maternal care. In some places, I've just mentioned that of cesarean section. When like a woman is pregnant for 10 months, she has not delivered. Sometimes it could even go beyond 10 months. It's like there's a spiritual angle to it. She must have done something that is holding this baby in her womb. But it's not always, it's not like that. So there are several other reasons for which that labor may not have started. And she could get help when she goes to the hospital.
Okay.
They know what to do with her to help her deliver the child. So once they hold her at that point, nobody is even thinking about how it's going to affect that woman's mental health, her psyche and all of that. and nobody is going to think of the fact that after the delivery, her life will continue. It also can also affect fertility, and it does affect stigma. So most of the time, if there is no child coming, there's something the woman has done. That's why. And sometimes they'll now go to the family and that's like this ABCD2 does not have child. It must be about this family. And in some communities, they consciously go to ask how many people have no child in their family and all of that. So it becomes a serious issue. It can also affect like HIV. You know, I think it's still in some communities then. The way they saw the HIV is like once they say the person has HIV virus, matter closed.
End of discussion.
End of discussion. And then they see that even her very presence will infect others, which is not true. HIV does not it doesn't get transmitted that way, which is not true. A lot of education has taken place, but we still need to continue doing that. We need to do more and all of that. So then we get to mental health. We talked about it last week, and how people still stigmatize others. Meanwhile, there are so many things in the atmosphere now, in the environment that can cause mental ill health for people. You know, can move them from the lower spectrum to a higher spectrum of mental illness. So to now tie it down to some of the stigma, they're like that, this, that, I think is wrong. So those are some of the areas that can be affected by the stigma that people hold on to.
So if you're following the conversation, one of the questions that may be on your mind would be, why have we continued in this pool of stigma from generation to generation? Is it impossible to break? Why has it lasted?
Yeah. Beginning from why has it lingered? Why has it continued? Leadership. Then secondly, I think we have not really worked at an intergenerational approach to different vital areas of our life, health in particular. And then when we're looking at that, look at it, one, we have, we talk about Gen Z, we talk about the baby boomers, we talk about Gen X. Why we talk about this, why we have these descriptions, because the way they see things differ. The baby boomers, that's the older generation, the middle age, their perspective on health differs. The way they see these things, they hold strongly to it. But as you start moving down, the millennials coming down to Gen Zs and all of that, they look at life like there's always a way. We can do something about it. And they don't take it so seriously like that. So what we need now as a people is to have a meeting point. The older generation is not completely wrong. But the younger generation also have something to bring to the table. Their outlook on issues, the older generation need to accept that it should come to the table. When we accept that meeting point, we're able to drop some of these stigmas that no longer hold. And that's where we should be going. Then we're also looking at, we are talking about how has it continued. Again, it had continued because we have not possibly come to the realization that every society that is going to have itself making progress must accept the dynamism of a changing world.
True.
It cannot remain where they used to be. You must be able to ask questions. You must be able to have useful and meaningful conversations. There must be, that conversation has to take place between the generations, like I've just mentioned. So, and that's a responsibility we must accept. So going forward, I think we should be having community conversations with regards to our health in particular. So meaning that we have the young, we have the middle age, we have the elderly coming together to have this conversation. Like most young people, you say that you are not feeling fine. I think you should take anti-malaria and stay home for 2 days. You should take paracetamol. You should do this. And the guy is telling you, Mommy, are you a doctor? Let me see a doctor. But right now, I know what is worrying me. I need to make some money. You see, that's how the young person straight. But the mother is already thinking, hey, if he doesn't get this kind of headache now, it may just result to death, this and that. Yes, because during her time, it had happened. But the young person knows that there are different aspects of health now. And there are different angles to it. Even from social media, he knows enough to know that when you don't have money, it can affect your mental health, and that your mental health can affect the way your body responds. The young person knows enough to know that, and then he just go. Even when he goes to Google and go and tell Google, I've been having a headache for 3 hours now. I've been this, and that. Google will say it's likely this, it's likely that. But the parents don't go to Google to find out. They rely on the experience they've had for years and what their own parents also did. So you see why and how we need to have this change. We need to embrace dynamism.
All right, if you just joined us, this is Health Connect Forum, broadcasting on Municipal FM 95.3, Abuja. My name is Imo Ebong, I'm your host, and it's been an interesting conversation so far. I just remembered a saying from a friend who said Nigeria is a country made up of over 200 million doctors. One of the only countries in the world made up of over 200 million doctors, because at every point in time, a Nigerian knows the solution to his or her problem, especially when it comes to health. Well, so far on the program, we've talked about stigma and misinformation and how they harm individuals and weaken public health systems. But we'll go on a break, and when we come back, we'll focus and channel the conversation towards generational and faith differences and how they shape health beliefs. Don't go anywhere. After the break, the phone number, you can send us a WhatsApp message. If you have a question or comment, you can send us a WhatsApp message to 0803 059 6162. Don't call, just send us a WhatsApp message. It's free of charge, so drop a comment if you have a contribution too. Feel free to send it via WhatsApp to 0803 059 6162. You want to get on the program, you want to access health information or care or support, get in touch with us at ROHAI. That is www.rohai.org. That is spelled www.rohai.org. Don't go anywhere. We'll be right back.
Across our communities, myths, stigma, and misinformation continue to affect the health decisions people make every day. That is why Reach Out Health Awareness Foundation, ROHAI, brings you Health Connect Forum, a public health education program created to inform, empower, and promote healthier communities through accurate and practical health conversations. From mental health and maternal care to disease prevention and community well-being, Health Connect Forum brings experts and communities together to address the issues that matter. ROHAI invites health partners, organizations, corporate bodies, and individuals to join this movement through sponsorship, collaboration, and participation. For more information, visit www.rohai.org, call 0703 044 8318 or 0813 973 0664. Health Connect Forum, powered by ROHAI.
All right, thank you for staying with us. Welcome back to the program Health Connect Forum here on Municipal FM 95.3 Abuja. On the program today, we're discussing stigmatization, myths, and misinformation. barriers to health awareness and access to accurate information, an intergenerational and interfaith perspective. Our guest on the program today is Barrister Mrs. Pat Udechukwu, and together we've had quite an extensive conversation. We've talked about how stigma and misinformation harm individuals and weaken public health systems. Just before we went on the break, I told you you can join the conversation by sending a WhatsApp message to 0803 059 6162. You can send us a WhatsApp message if you have a comment, a question, or a contribution. Do all to join the program. We look forward to hearing from you. The WhatsApp number once again is 0803 059 6162. For more information, you can visit our official website, that is www.rohi.org. Thanks for joining us. Barrister Mrs. Pat, we'll come back to you. Let's talk about generational and faith differences, how they shape health beliefs. We've talked about the Gen Z before we went on the break. Now let's also look at, faith, religion, how it contributes in shaping health beliefs. I know we've talked about it now, but we're now looking at it from the needle, the bird eye of faith.
Yeah. Very important, Timo. Very, very important, especially in Nigeria. And that's because we are spiritual people, we're religious people, essentially. So it influences the decisions and the choices we make, from the young to the old. And so it's important, this particular point is important to talk about. Why? Because even when an average Nigerian is in the hospital, everything you are telling him or her to do or avoid, he's listening with one ear, and then he's matching it side by side with what he had in his religious setting, and deciding whether, and even when he leaves hospital, if he's going to continue, will also be determined. Okay, let me give you an example. Some time ago, somebody almost died of a medical emergency, high blood pressure. Why? Because in her faith place, she was told that, no, high blood pressure, you can believe God. If you start taking these drugs, there will be no end to it. And she believed it.
Was this person a trained medical expert?
Telling her this?
Yes.
No, it's in her religious that they told her this. And she believed it more than whatever the hospital would say. And was almost going for it. You have had cases too where people withdrew people from hospital.
By faith.
By faith. And then the rest is history. You have had cases too where people wouldn't step out to get help on time. I know one case several years ago. She was diagnosed with cancer. And she said that I pleaded with her to go and start taking her anti-cancer treatment. And it's better to start it than to. She refused. And it didn't take long. The ugly one happened. She passed on. So, I think it's time to us to look critically at this intersection. What should the faith leaders do? Because I think they have a very vital role to play.
Indeed.
In this health journey that we are on. If they don't play that role, we may not get to where we're going fast enough. And what is there? Because of the position and the influence that they bear on the people, they can use it to support this drive to optimal health care service and wellness, quest for wellness. So how? If a religious leader can consent to receiving the needed knowledge and use that knowledge to counsel the people, because most of the time, people go to them for counseling more than any other professional. And they believe them. But the truth is that a religious leader, a spiritual leader, is not trained for everything. So competence is important in delivering care. If somebody is not competent for something, he is not licensed, doesn't have the right to give that care. Absolutely. So, and for them to also know that is service to humanity to refer people to where they get professional care. In fact, that they have done their job by doing that. Why they continue to offer the support required. It's also important, one of the ways they can do that is also to create opportunity in their faith groups, in their religious groups, to discuss and gain knowledge in different areas of health, like this mental care we have been talking about, like for maternal care, child care. We still have one of the highest maternal mortality rates, and I think it can reduce when these faith leaders get involved, because most of the time the women come back to them to say, should I go for this CS? That they say that she should go for CS, she's not going, pray for them and all of that. If the religious leader with the influence he has or she has says, no, just go, this is the right thing to do, it will go a very long way to help. And then it's important to also say that the religious setting can actually support. For example, when the health problem is fueled by socioeconomic situation of the person, religious leaders can offer, they can rally round to offer economic support. Help the person if he's unemployed to get a job. Help the woman who is pregnant, who doesn't have money, because she may have decided not to go for that CS because she doesn't have money to pay. They don't have money. They can offer them support to pay for the CS. They can help to reduce the factors that impact people's health. I think these are better roles to play.
Okay.
And not accept that people should take their word as a final word in a situation that requires the input of a professional. And the faith leaders can actually work together with healthcare professionals to give the people the best that they deserve.
True.
Yeah. So from time to time, calling professionals or experts in different areas come and enlighten people on how to maintain their mental health, come and enlighten people on how to take care of them when they are pregnant, come and enlighten people on how to care for their children, nutritionists come and enlighten people on how to make use of the diverse, food, we have in Nigeria to take care of the children. Okay, yes, the economy may not be so buoyant, but you can use what we have.
Are there affordable
way.
options?
Yeah, there are affordable options. The nutritionist can tell the woman, you do like this. If you do this like this, it will
You
help
can
your
achieve
children.
this.
Exactly. So the faith leader is in a very good position, in a vantage position to do just that. So you can see how he can be in the middle to bring the intersection that will help us work towards optimal healthcare that we all desire. And then also bring down the stigma.
Indeed.
When the people come together and the faith leader is there or the spiritual leader is there and the expert is not saying this is right, this is wrong, the stigma dies there. That's it.
So I like the emphasis that we have laid on this part of the conversation. There is need to train and equip religious leaders,
Yeah.
faith leaders,
Yeah.
with the right skills and
Information.
information
Yes.
to guide
Yes.
and point their followers
Yeah.
in the right direction. There was a time when traditional birth attendants were often referred to as quacks, until I think some people realized that, look, these people are closer to the people than the conventional healthcare services. So if we train and equip them, they can provide first aid services and then let them know at what point to stop trying and seek for help, professional, more advanced or professional care. Say, at this point, if this happens, refer the patients to the hospital. They can be factored into the health systems. I don't think it's impossible if you experts
Yes.
really look at
When
it.
I trained as a midwife, we incorporated them. We go to the communities to train them, to talk to them,
Yeah.
and to also look at what they're using to practice. So the knife, they had this crude local knives. So then they started giving them packs that contain the right things they can use. And then it was a very awesome time. I think along the line, it was through the primary health care. Then Professor Luke ran some Kuti, and then I think thereafter it went down. But some years back, understand they started doing something like that to raising community midwives in that area. So right now, I do not really know exactly the state of affairs, but I think it's something that will help us so much.
Indeed.
Yes, it will help
Indeed.
us so much.
Mr. Potts, let's bring the conversation back to young people.
Okay.
Earlier, we made reference to the statements that Nigeria is a country of over 2 million doctors. In quote. So, young people of this generation are now exposed to social media. Allow me to use the word social media medicine.
Yeah.
Should there be a way of verifying? Everybody now on social media is a doctor.
Yeah.
Everybody is doing counseling.
Yeah.
Just call their number, they'll cancel you.
Yeah, and doing
Some will
content.
cancel you to the gutters. So how can young people verify some of these information, especially health information that these young people are exposed to, can actually be verified? Talk to us about that.
Okay. Let me just mention an experience.
Okay.
As a younger colleague who had a baby last year, who had babies, and then she was always on social media to get information on the symptoms of pregnancy, on this. And then when she comes to us, I say, where did you get this from? Hey, that she's following this person and following that person and following the other person. And I said to her that, do you know there is a way to check if an information is correct? The person who is giving you or who has given you the information, what qualified that person to give you that information? What competence does the person have to have given you the information? I say, so this will come in the name of doing content. And they say it with so much boldness. So we're saying to the young people this morning, not everything on social media is correct. You need to also check with the experts. Is this thing correct? That's the only way to avoid mistakes. Because social media will not correct mistake. You can make mistake from what you got from social media. But social media will not come and cancel the repercussion of doing that wrong, taking that wrong step. So that's one. And then two, I was also happy to, not too long, I think some days back, I saw a young lady who said she's a doctor. I didn't verify. And then she's putting up a training platform. And she's saying that people should donate at least one person from their families to join, to come in for that training. And the training is for her to tell those people what to do when a family member had to get help, where to get help, and how to move, kind of a first aid thing, and the steps to take if there's a problem. I didn't verify her, but I think we need platforms like we are doing now.
Exactly.
To inform people on what to do. Okay, you should get help from this hospital. You can call the hospital number. You can do this, and there should be a collaboration. There should be a meeting point. Some people just sit down. They don't even know which hospital will I go now with this problem. How do I know that if I get there, I'll be attended to? And then sometimes the conversation was on emergency care. But I think we have left that. It has spread. It is wider now. How do I get help? If I get there, this particular problem, I have not seen it before. I don't have a child. I've never had a child who has this kind of problem. So which kind of doctor will attend to this child? Should I go to? How do I know how to reach that doctor? And then how do I, all of those questions. And that's why sometimes people don't come out to seek help for their health problems. So they just go to a place that is easy. They go to one chemist very close to their house, and the man wants to sell, he wants to make money. He keeps mixing drugs for them, and they keep taking. The matter is getting worse.
Allow me to just chip in there. It looks like a joke sometimes on comedy content online.
Okay.
You see a father will call a child, I beg, go chemist, tell Oga chemist, make him mix medicine.
Yes.
For malaria.
Yes.
Make him mix medicine for malaria. Well, let's talk about government because we're almost out of time.
Yeah.
Remember, you can join the conversation. You can send us a message via WhatsApp to the number 0803 059 6162, and we'll take a question or contribution. And if you need help and support, get in touch with us. Go to our website. That is www.rohai.org. That is ROHAI.org, and we'll get in touch. Now, how do we also deal? Now, I want to take us back to faith leaders and their role in dealing or managing the issues of stigmatization, and all that we're discussing today. You know, there's also the issue of conflict interreligion.
Okay.
The conflict of belief, even within the faiths. Is there a possibility of unified messages? This will now bring us to where government, NGOs, we must give credit to NGOs. NGOs are doing an amazing load of work. How can NGOs, first of all, religious faith leaders, work together? Government creates the enabling environment for NGOs, corporate organizations to rally around and see how we can do more to help our communities.
One, it's important to know that whatever belief you hold it to personally, if you're a faith leader, teach it to your own congregants. But like last week, we talked about health being a common strand that runs through humanity, no matter your faith, no matter your dimension of spirituality. So let's come together on that ground. Let's talk about empathy. Let's talk about social support. Let's talk about how we can keep a community where we care for each other, where we're able to offer support when we need it. Do you understand? So the faith leaders should focus on these things and leave the doctrines, the different doctrines, to the congregants. Do you understand? Because this is the only thing that seems to hinder it. And so when we come together, we live in a particular, for example, an estate, and we come together, we need to keep our environment clean. We need to keep mosquito off. It will help all of us. We need to be available. We need to keep peace among us so that we can help the next neighbor, irrespective of their religious inclination. We need to ensure that certain things are not around because they may hurt the children and all of that. So this is what I think that the faith leaders should focus on. What is it that we can do together? We can collaborate to do. And in doing that, we can aggregate the needed force or the efforts to tell the government, help us like this. And I just like you mentioned the corporate bodies, I'm just thinking that it has come to a time when we shouldn't be having our conversations for health care and optimal health service without involving the corporate bodies.
Indeed.
Because we are the ones servicing their systems and their businesses. Exactly. So we are just asking for a little back to us to help support us. Healthy communities will run the economy, and the economy run by healthy communities will thrive. So
that's
these
powerful.
Three can actually come together, Yeah.
Great. Well, if you just joined us, the program is Health Connect Forum. We're broadcasting on Municipal FM 95.3. Every time we hold these conversations, as if we don't have all the time. But the beautiful thing about it is that we can always come back next week, Wednesday. Today on the program, we've discussed stigmatization, myths, and misinformation. Barriers to health awareness and access to accurate information. Our guest has been Barrister Mrs. Pat Udechukwu, and I've been your host, Imo Ebong. But before we go, what will be your one magic word to everyone who's listening, whether you're a player in the private sector, corporate setting, whether you are in the government institution, or you are an NGO? A message of collaboration and partnership.
I'll take it one. It was one long message starting from to the faith leader.
Okay.
Seeking medical help. It's not weakness, it's wisdom. This particular one is enough to knock off the stigmas and their myths. To the NGOs, let's still push to do more. And this time around, let's look for how to drag the stakeholders together.
Yes.
And to government, they are doing something, but they need to do more. They should increase the health budget, but particularly, we need to have policies that enable this collaboration with corporate bodies, NGOs, and the community leaders
Indeed.
or faith leaders.
Indeed.
Policies that will drive it. Policies that are on ground
Okay.
that will drive it.
Well, I wish we had all the time.
Yeah.
But for today, we'd have to bring the program to a close. Not permanently, but we'll reopen the doors again next week, Wednesday. A big thank you to everyone who's been a part of the conversation. Thanks for watching. If you caught up the program online, and for those who are listening live as we speak. And to our guest here in the studio, Barrister Mrs. Patu Dechuko, thank you so much for joining us.
Thank you. Thank you so
All right,
much.
thank you so much. And to the Municipal FM and AMA Community Radio crew, thank you so much for playing host to us. It's been a great pleasure. Until same time next week, bye for now.
Across our communities, myths, stigma, and misinformation continue to affect the health decisions people make every day. That is why Reach Out Health Awareness Foundation, ROHI, brings you Health Connect Forum, a public health education program created to inform, empower, and promote healthier communities through accurate and practical health conversations. From mental health and maternal care to disease prevention and community well-being, Health Connect Forum brings experts and communities together to address the issues that matter. ROHI invites health partners, organizations, corporate bodies, and individuals to join this movement through sponsorship, collaboration, and participation. For more information, visit www.rohi.org, call 0703 044 8318 or 0813 973 0664. Health Connect Forum, powered by ROHI.